Ublatia Nunavut mute. Ublumi Takwa Nuvan Nalyaka to Nutat 8 Uyut. 14 Nuvan Nalyaka on Nertu. Katiluk Dalawit Takwa Nuvan Nalyaka to Nunavu Iloni 69. Matakwa Tamameluk Tata Baniakaluni Nuvan Nalyaka. 130 Nuvan Nalyaka on Nertu Mami Himayut and Elected Nunavu Iloni. Ublumi mitikilu aqua Nunavut mute Nuvan Nalyata Kutimi Kapio Himayut. He would look me Kapio Himayut 16,525 and Tituglia Nikapio Himayut 12,995. Aqua Nahauti Ublitama Padlao Yang Matatan Kuenak to ya. Ikpakatay government tokakuta tu kakalaw mata kinaya migo tu ni hikanang nelang mi mata Nunavut miu mata Nunavut mut tana Nuvan Nalya piji tigilugo mat na kimabuga ko yali chalunga lungat tao ta ko ikayu chatang mata government tokakut Nunavut mi tana kinaw yak amma ikayutit ilang kinaw yaw suni ilang ikayutaw na suni toranga na tu ila toranga yo takwa ilinya mi iluan mo iting iluni nutaka no paive bigalunut amma inutuga kaktuni inutuna ayokuni hinitawing iliga kang ng pata amma takwa inutu Iqaluit ayok halwak tu ikayok tau yakak tu anit dailiyut ikayok tau malo ni amma tigaw yaw hima bingmut tigaw yaw hima yunun tana kina ilanga Nunavutunga big incorporated amma uap tunutunyaw hima matakating aslu takwa Nunavutunga bikut pila katigiluit pinyatabu takwa kina yak kalamiw yok atok tau yu luang naman atok yakak tunu takwa ikayok tau yakak tunu kihanita na kinaw atut chalo pimal na tabun amma kalung miut kadok nana okare kanak tulu kanu okak kanak tulu mga amma tan tuhang ulak tau na tung kalung miut takwa kating ngatang ilauta imirea tolo ta kowe huga tolo ta amihulu ta pigakang itu takwa kablunato parties takwa Pigakang itu Iqaluit takwa anya kailitit sikut pekoyakang mata katingga kang inapta takwa igloyo meo katingin kita bu katitang ilaw labut anigo we inung ni katihinyang na we kinap pa me mato me atolotit takwa malik taw yali anya kailitit sikut pekoyang malik taw ipata tanan nuban na taban yakalung ni tabung alukta ila akunyuna khatamani naman takwa malik tau kayo yung malik sakop tigo kilamit nata na Nuvan Nalya ihuliyu luaman nungun luni uwaguluk ta tamap tuluk ta takwa maliga kakta bu malik tau kayo yut may nakachang na apta uwap tini amma inukatit tini nagiligayap tini ilap tini inakutit tini takwa malilaw labutan Nuvan Nalya ihulin niya makalamiw na kak tabung aluk ta ila ako ni Nuvan Nalya tamani nakpat immakao ya kuluni takwa hunaluk ta ukwa kamayu luak matahuli tan kalamiw na kak Nuvan Nalya tamani ngelakpat kalamiw na takwa ukwa tak kamayu ukwa tak palyayu luak na mga ta makingun lak ba mi ukalunga niwa kaya kang nakawit takwa nutakabut ang watabut nakatang ilugin nakal ayong nangin nakpat amma kapiyaw himang inagawin Nuvan Nalya takay kutimi kapiyaw niya puti taan atul lang makaput amma hiwulak pa mi kapiyaw himan nagawit tuglia ni kapiyaw yak tekan naluhi tako Nunavut miu mat na kimagpaka koyalihim mak lugata malit siyata mata kalamiw na Nuvan Nalya ihulun niya mata ko malik daw koyo malit siyalaw labot mat na ublokat siya na po him. Today we are reporting 8 new cases and 14 recoveries of COVID-19. There are 69 active cases in the territory, and all are in Iqaluit. There have been 130 recoveries to date since the outbreak began. So far, 16,525 Nunavut have received their first dose of the Moderna vaccine. and 12,995 Nunavut are now fully vaccinated. I'm glad that the numbers are going up every day. Yesterday, the federal government announced additional funding to help Nunavut in our COVID-19 outbreak response. We are grateful for this influx of in-kind and direct funding and are currently reviewing how to implement these investments, and these investments are in remote learning, support child care, social supports, and correctional services. We continue to work with Nunavut Tungavik Incorporated to ensure we are able to use any joint funding swiftly and efficiently. Iqaluit, I'm not sure how else we can say this, but please stop gathering. The parties, the social interactions with people outside your household, and the time outside with others without wearing your mask are just not worth it. The longer people keep doing this, the longer we will have to live with tight public health restrictions. This is a shared responsibility. Everyone is critical that we all follow the public health measures we have in place. Mask up when outside your home, always. Stay home as much as possible. Don't take your family out when you run errands if you don't have to. Keep strict social distancing with people outside your household bubble. Get vaccinated. Make safe, healthy, and responsible choices. And I thank everyone that is following these public health measures. The sooner we get rid of COVID, the sooner the restrictions can be lifted. Thank you very much.
Good morning. As of this morning, 4 Iqaluit have been medevaced south. 2 remain in hospital, and 1 of them is in the intensive care unit. 2 are recovering in Ottawa and should be able to come home soon. We continue to see spread of the virus in Iqaluit, including some through outdoor contact. If you are getting together with others from outside your household, please wear a mask and do it outdoors. If you have attended a party in the last 3 weeks, you should be tested for COVID-19. Please contact the hotline at 1-888-975-8601. If you've attended a party but cannot call or get through, please go to the Cadet Hall any weekday afternoon between 2 and 5 in the afternoon. We will test you for COVID-19, and this will help limit the spread.
Ubla tikitlu sitamat Iqaluit outlook tito si malak tutuwang naktukut kabluna ano nanganut maguk anyawing mi tuksuli ikata anyawing mi kawisakto innakaya kaktuni tuwang naktumitluni maguk arawa mi kanuituni paldiayu amma ang ikaksali yung malaklutik takugap tasuli tamakuninga anya paldiayunit nuwag nagduang ng siya may baldiyo ni tamani ikarung ni ilangit silami siya may katikak paldiab dutik katikang niyakop si inung katip sini silami kagliluak tayo lilugit ang matuak si mayakaya kaputi silami kaluak lutidun ni imiriak to katikak si magawit inuk si malusi sanatay lipinga suniatok si mayaptin ni kawai saktaw na yakawit nubag doang nakangikaluang mga pait. Tagunga ukalugun na puti 1-888-975-8601 mo. Imireaktok katikalawit innuk si mayunilunit o niguti si malawit. Tagunga ukalugi akak putit. Ang mayon nang ikawit tayo nga unalik sa yet katibyanut o niguti na yakawit kadat kamut. Ublukut sanan na utidlugo makung nuwakangan tadliman waksaklugo tayo kani kawisaktaw yun nakputit tamatumungan nuwag juang namut siya magwiyo si mangikalawang mga api.
I would like to discuss the vaccines used to protect ourselves from COVID-19. These vaccines are very effective against COVID infection. People who get vaccinated are much less likely to become infected. When they do get infected, they do not get as sick as they would have without the vaccine. And in addition, there is increasing evidence that people who are vaccinated do not spread the virus as much as people who are not vaccinated. In short, vaccines are the best protection for ourselves, our family, and our communities.
Morning.
Morning.
Ulumi ko sa mayong kaputi mitsano tamako sa pumayaw ko tiyo kunak to Nunavut 19 mo. Tako kaputi atu ti khatsak to Nunavut tak daily gunna nang. Tako kapiyaw si mayo tay mang Nunavut ta khatangin naksaw yun. Amalo Nunavut ta kay matatay mga kanimangin naksaw khatak to kapiyaw si mangit tunin. Kakan ni nga tako kayo naksaman naksaw dakto kik tako kapiyaw si mayo siyang mangin naksaw khatak to Nunavut mik kapiyaw si mangit tunin. Nainalo tako kaputi tako sa pumiyaw siya ko tiyo nakpanggun nakto uvatino ilatino no nakatitino lo.
A common question around the world is whether or not COVID-19 vaccines can affect pregnancy. To date, more than 90,000 women have received a vaccine during pregnancy, and both Moderna and Pfizer vaccines are safe during pregnancy. They do not cause miscarriages or birth defects, and they do not make it harder to conceive a child. We do know that the risks of COVID-19 are higher during pregnancy, and since the vaccines are our best protection, I encourage everyone who is eligible to get vaccinated. Last week, it was announced that Pfizer vaccine is approved for use for anyone 12 and older. As a result, we will be arranging to acquire some of this vaccine, but are unable to say when this will happen. When the Pfizer vaccine does arrive, we will administer it first in communities experiencing an outbreak or at higher risk of introduction. This is similar to how we approached the first round of vaccinations, and Iqaluit will likely be the first community to have Pfizer vaccine offered to children who are 12 and over. Like the Moderna vaccine, this will be voluntary.
Tana Nunavut 19 kaputi at tuwi nakaroon ng mga nadjiyunon. Ulumi mo 90,000 ng atani ito tako kapiyaw si mayo nadjitidluwin. Tamaki Moderna amalo Pfizer kaputi tako at nang indakakto yung nadjiyunon. Tako nadja ang iligo tao katang ito ubalo nadja ang ino at tuwi nakakatang ito. Amalo nadjigun na iligo tao gunang ito. Kaya mayuko tako luka nang ningin Nunavut 19 tako nang ningin gunanak sa mata nadjitilugit amalo tako kaputi tako sa pumiyaw siya ko tiyo nakpangong mata ayaw to kaya kakikuliman kapayaw kulugin. Pinasa ko si ulaw tuminalo na itaw lang ta na Pfizer vaccine ang itaw si malang ning ano tako nung susang no 12 ni kuilin no ungatanolo. Dahil may matakit siya sa anak tiyo piga sa alo tako nung kaputi ni Kasi hangak ko nang ito pigin na lamang ata. Tako Pfizer kaputi kasi malikata wala to sibulak pa minunalin ni tako nga sa makbiyo si mayon ay ubalon ni ulo ka nang naksayo na sa makbiyo nang nangin. Dahil matchay na piligid jo sigilaw tago sibulak pa may kapis kata tiglota. Amalo kalum ni ta na sibulak pa ngo gayak to tako Pfizer may kapiyaw katak to sugosang note. Okay, ulit no 12 na yung atanulo tayo matsay na Moderna titutaan na kaputi isa masulot ya ang yaksima yun kisa ni kapiyaw ko tiyo katalakto.
Ken Driscoll, EPTN National News. Dr. Patterson, when you were talking about the vaccine approvals, you said it was approved for children but safe for pregnant women. Is there a difference in those categorizations? I'm wondering, is it approved for pregnant women?
Kentus ko EPTN ko nita na sukusang nakaputa at na walang nakakabiutan at nadjiyon at na nakasugutan at tanang nila nadjiyon.
It's been widely available for pregnant women. We've been using it, offering it to women who are pregnant or breastfeeding since the very beginning. And there's ample evidence now, including published in Lancet and New England Journal of Medicine, that it's safe during pregnancy.
Tana atuinaw titawin nato na jiyunot atuinaw de khatakta bunat jiyunot ivang minila mamat jiyunot tana luna luna taw si maluni khawi saktaw si maninga New England ukhali magangin yan na hamnang itulari mo at tanangin nakaktaw si mayo.
Dr. Patterson, Iqaluit's a medical hub for all of Baffin Island, and most children who are born on Baffin Island are born here in Iqaluit. Are you still flying in pregnant women to Iqaluit considering the amount of cases we have, or are they being sent elsewhere to give birth?
Iqaluit na tutak billari matamak ko nga nadjiyo taka nadjiyo tamang sulayang nisud giakto katakha.
They're still coming here.
Sulay tamang tikikatak to. I need water. Kate, can you get me water, please?
Jackie McKay, CBC News. Do you have a number of how many Pfizer vaccines we will receive?
Ukakun nakikat si ni Pfizer kaputiti pigun na si mangape.
No, not yet.
Gasuli.
And we didn't get Pfizer originally because of the transportation issues around it. So will that vaccine only be available in Iqaluit, or will that be able to be administered in communities?
Tano Pfizer kaputi tamani pigun na si manginatigo tayo mga tukok daw si magaham ni nga huwag si maluni pidyo tigilugo tamani akalun ni kisa na tuwin na gayaka.
There's been some changes in the requirements to store and ship Pfizer over the last couple of months that may make it easier to distribute into smaller, more remote communities. But we don't know for sure if we'll be able to get it into every community or just some, and then the others will get Moderna when it, assuming that it gets the same approval.
Ita magkuhasid siya sa malakti, malitaw gaham ningi kano, tukot daw sa magaham mga ta, malawlak titaw gaham mga ta, Pfizer. Ayong nangin naksawlak to, nun nalin na mikiyaw tao naksayo na, ungasit tunulawlak titaw gunam nga, kisay na kaya mangit ila, nun nalin no tawas, at atoy na titaw gunala kayang mayo.
Could you just clarify what those transportation changes are?
Kasi naktiga ko kano, awlak titaw gaham ninga, no malitaw gahas ng mga ta.
It can stay in the what they call thermal shippers that require dry ice. It can stay in those for up to 30 days as long as the dry ice is replaced, and it can stay at -20 for up to 2 weeks.
Tako sulu nilijuito titu sulu teko panekti huangusu luni 30 ni tay may tumigun naksayu amalo minus 20 may to inagundalisutit pinasagusini makune.
And I forgot to include the other parts. It has to stay at -80 otherwise, and once it's thawed, it's only good for 5 days.
Kasi ni suli minus 80 mingin na kayalik amalo out si malito akata uluni talimani atok tawga kasi katakto.
I'm a transfer of the Canadian Press. Where are you looking at sourcing these vaccines from? Wondering if you're doing something similar to the Northwest Territories, looking at another province.
Nakita ko kaputi pikayakat siya tayo matsay na nunat sa amit ito asa ni kanatami abitok sa mayuviyo yun ay pinakisiyo.
Yeah, that's one of the options, and in that circumstance, we would have some of the Moderna that's been allocated to Nunavut would be shipped to that province, and then we would receive some of the Pfizer that they would have gotten otherwise.
Taman na ilangan na rin ako sa'yo. Sulo tamak ko, Moderna, tikikata yung mataas yan, no, kanatami abitok sa mabiyo yun, no, taos na malawat tiyo, vatino tikititaw si tako.
You said in your opening statement that some of the transmission has come from outdoor gatherings. Can you clarify what these outdoor gatherings look like? Are they the equivalent of a party with close contact?
Tako hausangotini haushaqaugavi silami tu katikattarningin no searman biuqattangata hausarigum naqqiutamakua katikattartunu silami imiqalattunu.
We know of a couple of transmission events that appear to have occurred during work breaks where people go outside together to have cigarettes. And there's one that appears to have happened with 2 children who were playing outside.
Ay magyugo makapti sa magbiuqattar sa maningin ne kanaya katigi sila mosigalaartoraarto katigi sa matillugu tillugit ammaluata sen khawi simayabukit khitongariya yusugusi aningwa katigi tillugu sa mak katigi tumini.
Dustin Batardi, Sac News. Can you provide an update as to the ages of the people that have contracted COVID-19 and whether or not they're symptomatic or asymptomatic?
Dustin Batardi na sa kuno hautiga nakitigo katsineu kiyo hakattamanga tamakono badjo naktas mayu.
So as of right now, there's about 23% that are under 18. The age range is as old as goes up to somebody in their 70s. And I can't remember the proportion that are symptomatic versus asymptomatic.
Mana yo tako 23% ni ukiuli 18 ni tungani lo. Tako le khatsine ku khakhayo khattatu 70 mo ilangi tikiyo mayo amalu iqamangitunga khatsillatani ku khattamangata.
I know this has been asked before, but given all the talk about enforcement and stopping the spread, is imposing a curfew an option, and if so, what would that take?
Tako malitaw kene kausi khattanga tako le kia solo ikakame unutanga ani teli kai na khattara hamne me khatsimu gai mataman na ismagi yastimaba.
So the public health orders, I don't think that I have the authority to do that. And more importantly, creating more aggressive orders when if individuals aren't listening to them right now, it's not really the point. The point is to find ways to limit the activity that is triggering what's happening.
Tako ana hamnang itulari na mamalitaw gali tako sangin na kakutigi balang itakatay maisulit tabihatit sinemo katsimi sikhungiya katsimo kay ang kasima katakaya hamnang ini kasi ni tamako ilagi amna ritugi mannaw yok nalang ito no hawi kasara haktugo kisu tamako kanu iliro taw katakto sa makutaw pala katang mga ta nokati taw kaso ang aluti.
Trevor, Nunavut News. Earlier you touched upon transmission. You said there's less transmission with vaccinated people. How much does it lower the chance of? How much does a vaccine lower the chance of transmitting COVID-19?
Trevor, right? Nunavut News kung nitay no hakawagabit sa masingin sa katang tatamakwa kapiyaw si mayo kanutigi sa masingin sa katakon naka.
That's still being measured to give an exact number right now. I'm not comfortable doing that, but in some preliminary studies, it appears to cut the spread in a house from one person who's infected by at least half.
Tamana suli kau isak tau bala yo katsul tayo mga takau ya mangito nga naluna tau smangima kisa ni kau isak tau bala semayo ni na sa martel titsikum nang nilo mi katigi na balongan ni nakatsiku tau katakto sa masiteligum na namin.
So in one study that I'm familiar with, they tracked individuals who'd received a dose of the vaccine and then later on became infected and compared the rate at which it spread in their house compared to other people who were not vaccinated, and the number of people who caught it from the individual who'd been vaccinated was about half of what it was from the non-vaccinated individuals.
Tāna ilanga hau isa ko tau semayo kalimang semaya nga hau isa ko tau semayo tamakua kapayaw semayo sulu ilumio katigini. Kapayaw semangitu ni takulugo adjigingin ni tako abaloang kapayaw semangitu nupa jo anak tanak sa kataktu kapayaw semangitu nini.
Have you identified any new trends in the latest cases these last couple of days, or is it the same?
Takwa nupa jo anak ta pala semayo pidyo tigilugo asidjak pala semabaka no sa makatak ningi.
No, nothing new in the last 2 days.
Agaulo ne makto ni taman asidjak semangito.
Ken Driscoll, EPTN National News. Dr. Patterson, been seeing a lot of sheriff's vehicles around town lately. I'm wondering what part are the employees at the Nunavut Court of Justice, the Sheriff's Office, playing in the enforcement efforts here in Iqaluit?
Just go EPTN kunilo ta Patterson takwa ikapto evik kunni policing wano na siyo kaya tupalo katalangata kanu takwa ikayo katamatata mo.
Thank you. There's a clear separation between the medical and the enforcement part, and the officials met with our officials met with the EIA officials met with the enforcement partners last week to finalize how it should work, and the bylaws. The sheriffs and RCMP are all working together, and our main goal is to educate, warnings, and then ticketing, and hopefully that'll be the way it goes. Nitakwa anyal taili tichigo ila ilwa kai merikut pileringi amatakwa maliktauga haktuni maliktit taktut ila ko mata takwa pukertali sheriffs mabaila pukertalingwait takwa tamang me katakatigi daw aptigo takwa maliktauga haktuni maliktit sinamata tana atwa lugo ilinyartiga qarlu takwa malingitu Okau jologit ama kingul lapami akilitit luit akiliya kami aliyang mituni ligu akiliga kang mata.
Premier Savikataaq, in your answer there, you said they were getting together to figure out how it's going to work. I'm wondering now, since that was a week ago, how is it going to work? How are those three agencies going to work doing enforcement here in Iqaluit?
Sulit sa Savikataaq ko katisima yamin rekaw gabi kanu taman na wala nakala kapinasa ko sulaw timi katilaw at sita ko pingasutimi uyo kanu pilira katigin na kamalitaw kenang.
The first point of contact for anyone who sees any violations, like to report it, is still the RCMP, and the three enforcement agencies will work together to figure out who should go to the call and what should be done. Taana kinamea ka takundak patako maliktaw giakak ni maling ito ni pukertaling ni okaluglo ni takwa pukertali pila katikang na matatako pukertaling wa ni baila matako sheriff ni kinatay kung kayang mga taana takuyo ga kayang mga takwa maling ito na komitiyo pero yanin.
Jackie McKay, CBC News. My questions are for Dr. Patterson. In the public health orders, is there anything that would allow essential workers to drop their kids off to friends or family so they're able to go to work?
Ana hamnang tulog ni mamalitaw galin ni tamakwa yakanaya halakito piyun naktitaw kitong amini pari nok sakataw nang ningi yakanaya ram narlut.
In the past, when that issue's come up, we've considered that as part of that essential or emergency service need to allow extra people into a house, either for children to go to a house to get childcare or for an individual to come in to babysit while people are at work.
Kiunit nita ko malitaw hatak sa mayo ilagi yaw lutiso luto avang nakpupo piyit sa raw takara hamningin no tayo mail ilo no isak titaw hatak nakto pa ginaktangin no.
The other activities that are considered part of that group would be things like essential repairs to the house or medical emergencies where ambulance attendants or others go into the house.
Tako asing ilo ani miyo tako isi katawag nakto solo tuwagan nakto ko sana gayakto kaya kaktilogit. Balo tuwagan nakto ko anak bilakto kaya kaktilogit.
In the funding announced today, I know that childcare was mentioned. Is there a plan for that money to go towards some sort of childcare for essential services? And is there anything you can say that would make people feel safe about letting their kids be dropped off at a daycare?
Tako kino ye nalo na tao si mayu pa rebin no tuwa na nakaktaw ka matay lang ito ka titaw na katako ya kanaya kalakit no.
Thank you. As I said earlier, we're still working out the details on how to spend this money and where it's going to go, so that hasn't been finalized yet. What's your color matna apagabit? What's your color matana kino yak mana kema wata would namud la retoran na mangan kina kalimi na ila kalimi kut tana kino yak atoran na lota would.
I was hoping Dr. Patterson can answer the second part of the question about if, for parents, if they can feel safe about dropping their kids off at a daycare, if one in Iqaluit becomes available.
So, yeah, we'd work with Department of Education and any daycare providers to ensure that any risk is as low as possible to minimize the spread of COVID-19 should that option become available.
Bilang kati kata tabuta ko ana ilin na nila ko tamako pa rive pejo tigil logit solo ulugan ng itek ko pa rive mo sa kata ko logit sa matay litit sigun na luti pa rive.
I'm the transfer of the Canadian Press. Yesterday we saw 14 new cases in Iqaluit. Can you expand on where these cases come from? Can you link them to anything? Are they from surveillance testing? Looking for some clarification.
I'm trying to Canadian Press ko ni Patterson no le sala ko 14 ni nutan no vadyo nakta sa mayuta ko na kinga simabat kawi saktaw ning itigo ubalo katiya mining itigo kano tamak ko na runareke.
The majority are through contact tracing. About 2/3 of the cases identified in Iqaluit have been found through contact tracing. Surveillance testing accounts for just over 10%. And the rest are either people that are just presenting to the hospital with symptoms or where we don't know for sure, like in the initial stages where the paperwork wasn't complete. We've got a few cases we don't know exactly how they were identified.
Tako ay sunak sa inal na ito hatak sa mayo katiya yung minang nakaway sakpan lahat ilawin. 2/3 abang ita kayo matano tama na kalam ni tayo mga katiya yung minang nakaway yaw hatak to kisa ni tamak ko kaway saktaw hatak ningi 10% nalo na ito hatak to it. Tako is ilang kano iguti kalagay kami na bila hatak to no nalo na ito hatak to kisa ni nalo yugo sulit ako kano ilang sa makbayo hatak sa mamangata.
You said the other day that we've had a few cases of people testing positive for COVID-19 who have been fully vaccinated, but we know Moderna is about 94% effective after 2 weeks after the second dose. Are these people who have not hit that 2-week mark yet? Can you clarify?
Wala ko bita ko ano pa dyan ang hatak sa mayo ilang kapiyaw sa magalo at tilugit. Tako 94% may atuti kam nakakta makaputi no vadyo nakta tailigun na mo tako kay 2 weeks na law tinagoit no vadyo nakta hatak to kapayaw law tilugi.
I don't have the exact dates in the data that I get on when they received the dose, or when they received their second dose of the vaccine, so I can't answer that question.
Tana kiugun nang ita hayo makatangin na hangak kutulian ni kapayamin yung mga ta.
Patterson News. Can you provide case updates for the medical boarding home, BCC shelters, and the Elder Center?
BCC and where? Elders. Tako Dustin Patterson na siya kung ni tako nakingak sa mga tanubad dyan nakta sa mayo tamato bimi kayok tao bimi nakko vinilo.
So the shelter remains at a total of 6 staff and clients. Corrections remains at 12. And I'm not aware of any new cases associated with the Elders Center.
Takuanga kahangit tugu vimme katilugi 6 kanayak dit amalutay kanimi utaminit amaluy kayok tao vimme 12 nutani kawi simangit tunga inak ko binni.
We're about a month into this outbreak. There's a lot of data, a lot of numbers. When you're assessing how things are going, what metrics or data are you looking at?
Takili mga kasawang taman na sang mapaliani nga katsiuning inni kisuni isamagi yakalo ang wakat takil.
We're looking at new houses, like spreading into new households where, that's as long as that spread continues, the outbreak itself is going to continue. And new work sites, those are probably the ones that we pay those are the ones that we pay the most attention to.
Mana how you salong katak tuguno tano illumiuno katigino sa maktohak palaning inni tako illumio katigino asingin no sa mapalaning ani taman na sa mapalangin na niakto amalo taman na kayusin ng niakto amalo kanayak biyo ni sa mapalayo ni tao how you sak palaya katak miyugo.
Trevor, Nunavut News. Is the people who have been hospitalized, do they belong to any, I guess, particular age group? Not speaking on specific ages, but yeah.
Trevor, right, Nunavut News kumita ko na bimiuni katak to kat sini ukiyo kakayupan.
They're all adults.
Inane.
Earlier this week, the NWT reported they haven't diagnosed any cases of flu this year. They were citing COVID-related public health measures. Has that helped out with any other respiratory diseases in Nunavut?
Pinasa ko si pigati lugo no at siya may naluna siya matatak ko akago tama kaniman nalawa katangin mata flu ngunira tayo may nubadyo na muamalita wiyali pidjutigil lugo taman na tao ipinali ko tao katak to ni Nunavut may taman na ati utakak si magiba kanin mateli katanin mo.
Yes, it has. We're doing far more testing for respiratory viruses than we did before this started. And yet we've noticed, like the majority of jurisdictions, we've noticed less influenza. And we've also noticed a lot less RSV, to the point where we stopped giving Synagis or Palivizumab at the end of April, which is early. But there was only 1 or 2 cases of people being admitted to hospital for RSV this year, which is unusual.
You stopped what?
Stopped giving Synagis, the antibody to protect against RSV.
Tama hawi si mayuguta ko ipinako teo lekatak to ni kanimangin naksaw katak ningin taman na pigala ko nganik amalo tayo mga kago tama kaniman na katak to mi kanimangin naksaw katak to amalo tako Synagis ngulirak tayo RSV mo tayo mga nuvali ko tayo gunak to mo April mini tayo mga tunisingin naksaw katak to gud ataw si makuto inalo ni RSV tak si mayu tayo mga nganik.
Ken Driscoll, EPTN National News. Dr. Patterson, you've talked some about youth who have caught COVID-19, 18 and less. I've been hearing reports of children less than 5, children less than 1. I'm wondering, what can you tell us about the youngest people here in Iqaluit who are catching COVID-19?
Ken Driscoll, EPTN kunita ko so sila nito sa katak sa mga 18 ukiuli nito nga nilo ukiuli fine ubalo ukiuli ataw sa khatsyo khatta kayo patako sa sila nubadyo anak taktoy.
Yeah, the ones that I'm aware of that I've looked into, it's most often all of the ones that I've seen have been due to somebody else in the house contracting COVID-19 through work or other means. and then bringing into the house, and then the younger children get exposed that way.
Tamakko hau khattar simayakka saamma biuga yonnersaa khattartu surusila tamakko surlu angeqami khatiminu innarminu vajuanartaartu khartillugu angeqamini saamma biusittaqu tamakko surusila.
Dr. Patterson, I'm wondering about people who are supposed to be self-isolating or are supposed to be in isolation. Is that strictly the honor system, or is there follow-up from the department? I'm wondering what steps does the health department take to ensure that people are following self-isolation orders?
Dr. Patterson tamakko anitteili titaugeeli nammini anitteiliga khartillugi suliyugiyauning innu malitau khattaqat ubalo ana hamnang ituliriyikko khawyiga khattaqa malitsaaqalo amangata anitteiligialinni.
There's regular follow-up, and for people who are infectious, we have the option of writing very specific orders that are aimed at an individual and compel them to be isolated, and can escalate from there if we need to.
Itakko khawyiga biu laula khattatu tamakko nuvajuanartaarsimayut immikkullu maligialinginni tunisi khattaqtigu maligiaaqartuninginni taima anitteiligiaqartitauninginni.
But those are the options of last resort. What's more important is to figure out what's happening, that what needs are not being met, or people are not able to meet while in isolation. And so whether it's for COVID-19 or tuberculosis or any other infectious disease, we're very reluctant to issue those kinds of orders, and they're often counterproductive.
Tamakko ilangin aliya ako tiyo yuking ulak pami taimeli ako tao sa khattartu malittaw kay kasasutik bimari unak sambali tamakko ay kayok tao gaya hamningi taima anitteili ningin nino vadyo nakto hakkata balupu valon nakto hakkata taima naluna siga so khattang itugila nikku tamakko ninga malittaw gaya ni tamakko nga atuti harum ni ito nakahangata balu malittaw gumay ito nakahangata.
Jackie McKay, CBC News. Nunavut, their public health is calling for more people to get vaccinated because their vaccines are about to expire. Are we at risk of having our vaccines expire?
Jackie McKay, CBC, kunita ko kumain nerve mi kapisi khatak tuita ko piu yun ni khatak ngata kaputi maksimalito ay mata ay ma isuligo ti yuhak ni usaba tamak ko nga kaputi ni.
No, I think the last couple of shipments of Moderna that we received they don't expire until September, if I remember correctly.
Gata ko mako tiki khatak sumayo Moderna kaputi isulit bitsali piu yun ni kayak to September mikisani.
We've been talking a lot about enforcement, and you've been saying that that's only part of a drastic part of the solution to make people follow public health orders. But in the funding from the federal government, Mark Miller says that $500,000 is going towards enforcement from the money we're getting. Why would we need that much more money for enforcement?
Kala ko bitan malitaw kay nilagi yaw to nang nakaksugot tamat mga akiguti gunak to malitaw kay nang maana kam nang itulan nang malitaw galit. Tako 500,000 kinaw yan naluna tawlaw tumalitaw kay nang mosumma PVCO.
Thank you. It's all under the umbrella enforcement, but there's also money in there for isolation if people can't properly isolate, as I said, in the hotel, or if they need more support while they're isolating. So it's all entailed in there. Itana tawanga yukina te kunga ta ko maliktaw yeri maliktaw chama ngata ki henita kumailoni tana kina ta atok kina yok tau atok tau ni ata ko inutu ni ayok tu ubaluba inutu ni ayu inutu chana ayok tu hinita mo iliyaw ya kapata ubaluba ta ko inutu yut anite di yut ikayok tau kan nakakang napata.
I'm just hoping to get a clarification on that answer. So you can see from the tweets from Mark Miller that he spells out the money for where it's going, and one of them is the hotels, but that's separate from that 500,000. So, is that going to go to enforcement, that 500,000, or are you going to allocate it somewhere else?
Tana tukusinakti ako tako kina ye tako lo to yo mivimo imiko ngamata kisani tau tana 500,000 imiko ngalo ni malitaw kay nang mo kano atok tau laka.
We'll be allocating where it's needed, and like I said, we're still looking at all the options of exactly where this money will be going. We just got the announcement yesterday, so we're still looking at all options. Tana kinaw yak tekung toanga yok maliktaw yak maliktaw na mga tana huli kami ko tabu tana kinaw yak namudla toang na mga ikpagkata ko kami takakut hakete ila hakkeha mata na kinaw yak kaitaw na mata ikpagkaukaha mata.
I'm a transfer the Canadian Press. As Kent said earlier, we have seen an increase in enforcement out on the streets here in Iqaluit. How many tickets have been given out to date?
I'm a transfer Canadian Press kuni Kent ukakaw mata ko malitaw kay tamak kuni nga maligam na miso na sa mata kalun ni hanuti yaklit taw kalaw ka ulomem.
Thank you. We don't. I don't know if there's any tickets that were issued, but we've got a total of 39 complaints that were acted on, and I can break that down more. Not applicable was 10. Gatherings were 16. Isolation breaches were 4. Mass was 2. Outdoor gatherings 5. Unknown 2. Takwa kapit akilitit ti ila alileo me akilia ko yo hitunyo hima mga tata na kawi mangita ka kihanita ko pukertaling nut ukaluk himayot unika quality la quality ta ko maliktaw gali maliktaw mata katiluk talo 39 nguyut ta ko kulit kawi man nangito hunapidjuto mga ukaluk mata ta ko kating ngayut 16 anitay liga kaktut aniyut hitaman kina pak matwa me atung itu maggo hilami kating ngayut amihulo tutik taliman kawiman nangito maggo katiluk talo 39.
Just to clarify, so those are complaints, they're not any tickets or charges, no fines laid?
Tako nilo taw sumayo akilitit sigo taw sumangitui.
Correct. That's the complaints that have been received since May 5. Ni takwa May 5 may pigali ulum tikit lugo takwa 39 pukertaling ukaluk himayo.
Dr. Patterson, please. Have any of the people who are hospitalized in Ottawa right now, are they, any of them clients of the men's shelter or inmates at one of the correctional facilities?
I can't hear you.
Yeah, I don't think it's on.
Something's wrong there.
Yeah. Any of the people who have been hospitalized in Ottawa, are any of them clients of the men's shelter or inmates at the correctional facilities?
Tako nit simayo aner alam mi arawa mi angutino ang ikahangitok ko bimingak smabaw balay kayak taw bimingak smaba.
Definitely not from the corrections, and I'm not certain about the shelter. I don't think so.
Ikayak taw bimingak smangito nalunang ito kisa ni ang ikahangitok ko bimingak mga takaw yung mangito nga.
Tech News. Obviously, a major incentive of getting the vaccine is your own well-being, making sure that if you get infected, that it doesn't become serious. At any point, are you considering easing restrictions for people that are vaccinated as a sort of incentive to become vaccinated?
Dastan patayan na siya kung nita magkuha kapayaw hatak to ima inusam mino kanu itay ligo malutin alunang itu galwa malukan matay ligo nanang mo tako likya maligay lingin kasuyaw gyak ni usaba tamak kuno kapayaw simayon.
sorry, just thinking of a way to word it, just because it's a bit of a chicken and egg question. Some of the jurisdictions that have eased or will be easing measures are easing them because their vaccination rates are high enough that the slight increase in risk of introduction is offset by the fact that the harms will be reduced because so many people are vaccinated. So following along that way of thinking, we need to get our numbers up higher, especially in some of the outside of Iqaluit and a few other communities, because a single introduction event could lead to significant spread of the virus.
Tamanna kiukasaaqaanga narunartu ilangi tamakkuni kanatami avittursama viuyuni khasuballe atutseqattalenga taamissuunersai kapiyausimani kunginnuut takkua pidjutigillugit amissuunersai kapiyausimaleqqata uluqianartumiinginnersauga yangata amissuunersai kapiyausimaleqtillugi taimai maamissuunersani kapiyaugiallakkannequyugu piluartumi iqaluisilataani saarmartoqalerneqqa tamanna saarmartummaqialuuga yangaat taimai makapiyaugiakkanneqattaquiyugu tamanna sapumiyauguutiuneqpaangoqataugunnangat.
That scenario may change as we measure how much spread can happen from somebody who's vaccinated and gets infected, but for now, that's really what we're waiting on.
Mana yu taima takugumagayaktugu taima hawilaunginittinni khanutigi kapiyausimayugalo saarmartitsigunnar mangata hawilaunginittinni saani kapiyaugiallaqattaquyugumaanna.
I'm not sure who this question's for, so I'll let you guys figure it out. In just about 2 weeks, ministers and MLAs are supposed to be gathering here for the spring sitting. What's the status of that?
Pinasaarusigalay naane maligalirti katimani usammata ministerilu tabbani khanulle tamanna.
So far, the spring sitting is set to go ahead starting on May 27, but most of the MLAs will be joining virtually. That's on video. Dan katimanet May 27 pigerto koma pigernerto takom tabbani kehnitako maligelertiu yut taqayautikut ilaw qatawniamata kehnitako minister yutamaanin.
Dr. Patterson, please. Sorry, you can't hear me. Dr. Patterson, please. Dr. Patterson, just to follow up on your earlier answer, you said your office has the ability to write very specific public health orders for people who might require some more guidance to follow public health orders. Over the course of this outbreak here in Iqaluit, has your office written any of those very specific public health orders?
Patterson oqaqqaaguitaakku immikku malitaugialinni aaneaqarnagittulerna mutunisiqattarnerarsuti tamaani qallunni teemeittuni tunisigiaqalarqi.
Just one.
Atausituarmi.